Good morning, everyone. I'm Álvaro Return, and today we're going to be talking about Unit 4, which is based on the chapters 24 to 34. Now, the exercises of chapter 24. Match the two parts of the sentences. Look at A, B, and C opposite to help you. 1988 saw the UK launch of Live Attuning. The answer is measles, mumps, and rubella vaccine. Now, chickenpox is a common infectious. The answer is diseases of childhood. Rabies has an incubation, which is a period ranging from 4 days to many months. The patient remained febrile. That answer will be with peaks of temperature of 39.5 Celsius. He was admitted with a 4-day history of influenza type symptoms of fever with a rigor, malgay, and general malaise. Now, quite a proportion of patients recover from hepatitis B. The answer will be become carrier of the virus. The central part of Africa is in the midst of an epidemic, which was of AIDS. Now, measles is most infectious during a carthural stage. Now, Lyme disease is caused by transmission, which will be of B. burgdorferi from animal to a man by exotic ticks. Now, PUO stands for pyrexia of unknown origin. Now, complete the case report of the patient in A opposite. Look at A, B, and C opposite to help you. On examination, he looked well. His pulse rate was 100 beats per minute and had a palpable spleen. Combination of fever and splenomegaly in a patient who has recently returned from Africa strongly suggests a disease of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed with the presence of parasites in his blood film. Now, complete the sentences. Look at A, B, and C opposite to help you. An infection which can be treated successfully with antibiotics is a bacterial infection. Now, another word for an epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is afebrile. Now, the common infection with Epstein-Barr virus is known for as glandular fever. Now, exercises of chapter 25. Complete the table with words from A, C, D, and E opposite. Now, noun and adjective. We have affect, affective, anxiety, anxious, behavior, behavioral, dementia, demented, disturbance, disturbed, suicide, suicidal. Make word combinations using a word from each box. Two words can be used twice. Look at B, C, and E opposite to help you. We have behavioral disturbance, eating disorder, major depression, mental retardation, personality disorder, psychomotor disturbance, and substance abuse. Now, complete sentences. Look at A, C, D, and E opposite to help you. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden triggers of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia. A disorder which is not associated with a pathological changes is a functional disorder. An idea which forces a patient to repeat unnecessary action is an obsession. Now, which symptoms of depression was this patient suffering from? Look at C opposite to help you. Now, a 56-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. Now she was tired of fatigue. She had a loss of interest, which is anhedonia, and poor sleep, which is also early waking. Now, exercises of chapter 26. Complete the table with words from A, B, and C opposite to help you. Active and noun. Blind, blindness. Conscious, consciousness. Deaf, deafness. Dizzy, dizziness. Numb, numbness. Lighthead, lightheadedness. And unsteady, unsteadiness. Now, make word combinations using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptic fit, frophomal symptom, syncopal attack, urinary incontinencies, and visual activity. Now, a doctor is trying to determine the cause of lost consciousness in a 52-year-old man. Complete the doctor's questions, look at C opposite and at the table 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you black out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any abnormal movements while you were unconscious? Now with chapters 27, the exercises. Complete the table with words from A and B opposite. Noun, adjective, absence, absent. Diminution, diminish. Flaccidity, flaccid. Static, which is the same. Waste, wasted. Now, a doctor is giving instructions to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. Now, I'd like you to relax. I'm just going to move your arm up and down, which is muscle tone. Can I see your hands? Will be inspection. Now, I'm going to straighten your arms out. Try to stop. It will be the power. And can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Will be coordination. Now, complete the sentences. Look at A, B, and C opposite to help you. A at the table in 27.1 above to help you. Now, a flaccid hand droops limply to form a right angle with the wrist. Exaggerated reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. A tic is a form of involuntary movement. A key is often used to test the plantar response. Now, his coordination was poor. He could not perform rapid alternating movements. A tendon hammer is used to test reflex. When something is diminished, it is less than normal. Now, a patient is brought to A&E in coma. When her name is spoken, she opens up her eyes, but she does not answer or obey instruction. What is her GCS score? Her GCS score will be 9, because it will be 3 for eyes, 2 for verbal, and 4 for motor, which will be 9 out of 13. Now, exercises of chapter 28. Complete the sentences with the table with words from A and B, and also C opposite and related forms. Verb, noun, and adjective. We have cure. Noun will be cure, adjective, curative. Next we have exercise. The noun will be excision. We don't have an adjective. Grow, we got growth and growing. Invade, we have invasion and invasive. Obstruct, obstruction, obstructive. Palliate, palliation, palliative. Palpate, palpation, palpable. Spread, spread, spreading. Swell, swelling, also swelling or swollen. The notes below are about the patient describing B opposite. Use them to include the sentences and include the correct order. To make the next paragraph of the case report, use appendix number 2 on page XX if you need help with the abbreviations. Now, we have the first one, OET 37.8 Celsius will be the on examination, his temperature was 37.8 Celsius. Then we have smooth, firm 3x4 centimeter mass in R supraclavicular fossa, which will be there was a smooth, firm 3 times 4 centimeter mass in the right supraclavicular fossa. Now, nodes 1 to 2 centimeters in diameter, palpable in both axial and inguinal areas. That would be, there were enlarged lymph nodes in both axial and inguinal areas. Now, oropharynx and AD will be his mouth and throat were normal. P 100 over minute, which were regular, and BP 112 over 66. That would be, his pulse rate was 100 beats per minute, regular, and blood pressure was 112/66. Now, we have CVS and AD, RS and AD. That basically means his cardiovascular and respiratory systems were normal. A ab mass palpable 3 centimeters below alcostal margin. That would be an abdominal examination. There was a mass palpable 3 centimeters below the left costal margin. And CNS and AD, which basically means an examination of the central nervous system was normal. Now, complete the sentences. Look at A, B, and C opposite to help you. Distant spread of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty of swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer. Now, tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of a primary. Now, if a cure is not possible, palliative treatment should be given, and an enlarged liver suggests metastasis. Now, exercises of chapter 29. Complete the sentences. Look at A, B, and C opposite to help you. A baby that is born a week before the EED is a premature. A termination of pregnancy may be necessary for medical reasons. The 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage of labor is an indication of cesarean delivery. It was a breach. Presentation and delivery was by forceps. A miscarriage is another term for a spontaneous abortion. The umbilical cord was wound tightly around the baby's neck, and it was unfortunately fatal. Now, complete the table with words from A opposite. Verb, noun. Abort, abortion. Delivery, deliver, delivery. Induce, induction. Miscarry, miscarriage. Present, presentation. Terminate, termination. Now, Dr. Bennett and SHO is presenting a patient at a weekly meeting in the obstetric unit of the hospital. Complete the presentation with the correct forms of verbs from 29.2 and above. Now, this is Claire Davis. She came to the antenatal clinic at 9 weeks in her past obstetric history. She had a pregnancy when she was 18, which was terminated, and another 1 year later, which spontaneously miscarried. Since then, she had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fatal distress. And the third baby presented as a breech and was delivered by cesarean section. Now, exercises of chapter 30. Make word combinations using a word from each box. Look at A and B opposite to help you. Blood stain, breath sounds, pleural rub, productive cough, and vocal resonance were the words that I made. Now, we write the questions using words that are better known to patients. Look at A opposite to help. Is your cough productive? Will be, do you bring a foam when you cough? What color is the sputum? Will be, what color is the foam? Is it ever purulent? Is it ever pus-like? Have you ever had hemoptysis? Have you ever had cough out blood? Do you suffer from dysphonia? Do you get short of breath? Now, are the following statements true or false? Give reasons for your answers using your medical knowledge and A and B opposite help. Patient who has a loose cough produces foam. That's true. Crackles are heard when the airways are narrow. That's not true. A patient who has a non-productive cough produces sputum. That's also not true. Wheezes are typical of pleurisy. Also not true. And pleural rub is a sign of asthma. That's not necessarily true, so no, it's not true. Now, over to you. Use the notes below to write a case report and add your provisional diagnosis of the case. Use appendix number 2 on page 131 if you need help with abbreviations. Begin. A 36-year-old man complaining of right-sided chest pain. 36-year-old comes to a sudden right chest pain with SOB while watching TV. Pain increases by deep breaths and coughing. SOB persisted over the 4 hours from its onset to his arrival in the A&E. SL, non-productive cough. PH and FH nil relevant. 3 out of 52 holiday in 30 in Australia and 3 over 52 previously. Now, OE and T of temperature would be 37.4 centimeters. RR will be 24 minutes per 24 minutes per minute. GBP increases for 3 centimeters, and blood pressure will be 110 over 64, and beats per minute. Blood will be 128 per minute. Now, RS, chest extension, reduces because of pain. Pleural rub in the right lower zone posteriorly. No other added sounds. Otherwise, NAD. Recent diagnosis. My diagnosis is pulmonary embolism. Now, 31. Exercises of chapter 31. Complete the description of herpes zoster or shingles by replacing the medical words in brackets with ordinary English words. Look at A and B opposite to help you. Shingles usually start with pain and soreness. Then red spots or macules appear that develop into groups of blisters or vesicles over a particular area on one on one side of the body. In most patients, new lesions or lesions continue to appear for 3 to 5 days. The blisters or vesicles, as before, become pustules or pustular, and then form scabs or crusts. In severe cases, there may be scars or cicatrices afterwards. Now, read the description of the rash of rubella and complete the notes. Look at A and B opposite to help you. Now, spots are scattered pink macules which appear first behind the ears and on the forehead. The rash spreads rapidly first to the trunk and then to the limbs. Location and distribution. Behind the ears, face, trunk, and limbs. Grouping, scattered, type of lesion, macules, and the color is pink. Now, complete the notes for the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Now we have location distribution. Will be mainly on the trunk. The grouping will be widespread or scattered. Type of lesion, macules or papules, and the color is red, likely chickenpox or viral exanthem. Now complete the notes for the lesion in the photograph and suggest the diagnosis. Look at A and B opposite to help you. Location and distribution. Around the eye, grouping will be single, type of lesion will be nodule, and color will be skin color or dark. That would be a basal cell carcinoma. Now, exercises of chapter 32. Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Look at A opposite to help you. Common word, medical term. Now, common word, medical term, type of force. Bruise, contusion, or blunt. Cut will be laceration or incision. Type of force will be sharp. Raise, abrasion. This is due to friction. Scratch, also abrasion and also friction. Stab wound will be a puncture wound and also penetrating wound, which is a type of force. The tear will be a laceration and the force will be a tearing force. Now, choose the correct words to complete the description of the injury shown in the illustration. Look at A and B opposite to help you. Now, there are grazes above the left eyebrow and on the left side of the neck, a laceration to the left side of the lower lip and cuts to the left cheek. Now, write a description of the injury shown in the illustration. Look at A and B opposite and add 32.2 above to help you. The man we see here has a stab wound on the right side of the chest and a cut on the left shoulder. Complete the sentences. Look at A, B, and C opposite to help you. Frequent changes of position are necessary in the immobile patient to prevent the development of a pressure sore. He had several stab wounds in the abdomen from the knife. He was knocked unconscious by a heavy blow to the head. The wounds were only superficial and required no treatment. Now, these are the exercises of chapter 33. Look at the conversation A opposite and complete the notes about Mr. Jones. Use medical terms where possible. Frequency, and nocturia for 1 year. No dysuria or hematuria. Stream a little weaker. Now, no inconvenience apart from occasional inconveniences. Now let's see and match the patient description in other symptoms with the medical terms. We'll get A opposite to help you. I have to pee every half hour or so. That would be frequency. Now, I get a scalding pain when I pass water. Would be dysuria. I have to get up several times to pass water at night. Will be nocturia. I have to rush to go to the toilet. Will be urgency. I have trouble getting started. Will be hesitancy. And I can't hold on my water. That would be incontinency. And I pass some blood in my urine. Will be hematuria. Now, write the doctor's question for each of the symptoms in 33.2 above. Look at A ups to help you. You will need to think about of your own questions for urgency. Now, first we have how often you pass urine, because of course we are talking about frequency. And do you have pain when passing urine? How many times do you get up at night to pass urine? Also, do you have to rush to the toilet? Do you have difficulty starting to pass urine? Do you ever leak your urine or have accidents? And also, have you noticed any blood in your urine? Here, we're obviously talking about hematuria, which will be blood in the pee. Now, describe the findings of the laboratory reports. Look at the opposite to help you. Here we can see blood, protein, and cast. We have positive signs. Now, there is blood present, a large amount of protein, and no cast. Now, exercises of chapter 34. A doctor is talking to a patient during ophthalmoscopy. Match the underlying expressions she uses to expressions with similar meanings from A opposite. Now, right, Mr. Bowman, because you'll be having these headaches and I'm going to have to look at your eyes, particularly back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. And after a few minutes, you may find your vision a bit blurry. This will wear off after an hour. Now, I need to get rid of as much of external light as possible. This means closing the blinds. Now, I like you to look straight ahead at the clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me, look at the clock. Now, we can see lines, and the first one will be the examination is done with dim lights. This will be the third one, because here we talk about I need to get rid of as much external light as possible. This means closing the blinds, and we have B, which will be number one, because a topical mydriatic solution, which is a couple of drops. The C, letter C will be to A dilation, or the second underlying phrase will be which will make it easier for me to see the retina. And the last one, which is D, is the last phrase or sentence, which will be fixating on a target. Here we can see that is look straight ahead at the clock. Now, complete the instructions. Look at the opposite to help you. Wrap the cuff around the patient's upper arm. Place the stethoscope over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. Close the valve on the pump. Pump up the pressure to at least 150 and then open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. The first sound you hear is the flow of blood through the brachial artery. The valve on the gauge at that point is the systolic pressure. Now, continue listening while you slowly deflate the cuff. The diastolic blood pressure is measured when the sound completely disappears. Now, let's see this. Complete the sentence. Look at C opposite to help you. Phlebotomists are especially trained in taking blood. They are skilled at venipuncture, puncturing the vein to take blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. It is difficult to locate a suitable vein. The patient may be asked to make a fist or a tourniquet, maybe apply on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising. At the site, it is important that blood samples are labeled correctly before they are sent to a hematology laboratory or hematology laboratory, where a full blood count or other investigations will be carried out. These were chapters, or more or less, the Unit 4 of Professional Medical English, which covers the chapters from 24 until 34. Thank you for listening about me explaining it to all of you, and thank you for watching.